One of the methods commonly used by nurses to assess and identify the physical adaptations that occur between mother and fetus is Leopold's maneuvers. Leopold's maneuvers can be performed after approximately 24 weeks of pregnancy and during labor. The maneuvers refer to methods of palpating the maternal abdomen. The 4 maneuvers determine fetal presentation, or the part of the fetus that is closest to the internal os of the cervix; fetal lie, or the relationship between the maternal and fetal longitudinal axis; fetal engagement, which is the entrance and descent of the presenting part into the pelvic superior straight and canal; fetal attitude, which assesses the degree of flexion of the head. Difficulty may be encountered in performing these techniques on an obese patient or a woman who has excessive amniotic fluid. Leopold's maneuvers should not be performed on a patient with a history of unexplained vaginal bleeding or preterm labor.
The assessment of fetal presentation and position yields invaluable information that assists the nurse in predicting what kind of delivery will occur.
The most common potential atypical delivery types identified by Leopold's maneuvers are posterior position or multiple gestation. Leopold's maneuvers can also reveal the general location of the fetal heart, whether engagement has taken place, approximate size of the infant, whether size is appropriate for the length of the pregnancy. It also is a means of assessing the possible emergence of stressors that may give rise to high-risk situations for either the mother or baby during pregnancy, labor, and delivery.
Let's return to our examination of Heather, who is 32 weeks of a 40-week gestation. Heather is in excellent health and has had no complications during her pregnancy. Let me make you a little bit more comfortable on the table.
Okay.
You did say you had a chance to use the restroom?
I did.
Have the patient empty her bladder prior to the examination. This will increase her comfort as well as prevent the bladder from altering the accuracy of the findings.
How's that?
It's pretty good.
Position the patient so her head is slightly elevated and her knees are flexed. This position is not only comfortable, but reduces stress on the patient's lower back and promotes relaxation of the abdominal muscles. A relaxed abdomen facilitates the assessment and palpation of the uterus and its contents.
Okay, Heather, I'm going to have you take your jeans down a little bit so I can examine you more thoroughly. Great. Perfect. I'll put a drape on you.
Lying in the supine position may have an adverse effect on the blood supply to the infant.
Also, Heather, it's really important not to lie flat on your back when you're pregnant.
Patients can experience supine hypotension during pregnancy. Thus, the nurse places a small towel under the right hip. This action displaces the weight of the uterus off the major vessels, promoting better circulation to the fetus and mother during the procedure.
To keep your weight off your back.